My name is Dr. Blanca Fresno, and I have here the best group of women to talk about breastfeeding. So what I thought we do is say who we are and what our experience with breastfeeding has been so far as a way of introduction. So I'm just going to tell you that I am a pediatrician and I was not able to breastfeed my babies. And so I made it my point to collect stories and to collect information and to collect ways to encourage other women like you to be able to breastfeed.
Okay, hi, my name is Marilu Cepeda and no experience with breastfeeding. I'm 7 months pregnant.
And my name is Kika Sandoval. I am a lactation educator and a lactation consultant. I did breastfeed my own 3 daughters because of the information and background that I had. Had I not, I probably would have done very short time.
My name is Erica Baltazar. I have a 2.5-year-old son that I was not able to breastfeed, and I'm kind of making it my mission to try and learn more and educate myself more on the breastfeeding process.
And my name is Sarah Schoenfeld, and I have a 15-month-old that I have fully breastfed, no formula, and he's my only child.
This is fantastic. So it's every possibility really under the rainbow of breastfeeding. So what I like for us to do here is to have a conversation and bring up the main concerns that a mom to be could have, a new mom with a 1-month-old baby, and a mom that's about to win her baby. So it's all the different stages. So let's start with the concerns of the mom that's about to have a baby. What's in your mind? What do you have right there, jumping?
That's one of my biggest concerns or anxiety is, will I be able to? Will I be able to produce milk? Will the baby be able to latch correctly? Just pretty much everything. Seeing the pumping, that machine is intimidating because I don't know anything. When I see it and hear it, it's intimidating. So pretty much that.
Good. So Kika, is that a common concern, and how do we overcome it?
It's very common to be very concerned with at the beginning about breastfeeding. One of the things that we do recommend is taking some classes, maybe getting some information, some background. This way you are prepared when the baby comes. It is on-the-job training because once you have the baby in your arms, most of the questions will come.
And it won't be so foreign to me like it is now. I'm like, okay, I remember that. Or
yes,
okay.
Yes, you'll have more of the answers and more of the support of where to go, who to look for, to get answers later on.
What are the things that she could have at home ready to go before even going to the hospital to have this baby?
Really, all you need to have are 3 good nursing bras that you can get somewhere about 36 weeks and on. You need to have a lot of support from friends and family. So make people aware that you are interested in breastfeeding, what your plan is. I think one of the biggest reasons a lot of women stop breastfeeding is because you hear things like, well, why breastfeed? You know, why just go easy? And then moms become discouraged in those moments of weakness.
And another question my husband also has is, he wants to support me, but what is his role? Because he feels this is 100% on me, and he kind of feels a little helpless. So he wants to be able to, how are ways that my husband can, or partner can help?
Bring them to the class with you. They get a lot of information on what to do, but the biggest thing to do is when the baby wakes up, bring the baby to you, give you words of encouragement, remind you of little things that we might have forgotten. One of the things that I like to do is when the father is involved is teach him how we get you started so that they become your support person, your coach at home. Okay. Kind of the positions, how to turn the baby, what to look for when the baby is eating, and how to know that the baby is getting enough.
Oh, okay.
Yeah, when babies feed, naturally the next thing that happens is that they poop. It's a reflex. So when I give my baby basics classes, I tell that the dads are the first support system, and they're also the official diaper changers in the team. And yeah, it's a big help because just think of all the dirty diapers that are there. And they're also the ear, the listener the one that receives sometimes the frustration from mom, because moms do get tired. So you just had this new baby, and how is it going at home?
It's good. It's kind of like you said, it can get a little discouraging at times because you don't know how much your baby's eating. You don't know whether he's getting enough. Is he still hungry? He sleeps during feeding, so it does get a little frustrating. I could see how it could easily be turned into formula and wanting to go that route, and it does take a lot of dedication. It does take a lot of your time and trying to stay up while you're feeding the baby because they're eating every hour or two. And but I mean, he's latching on great, and again, support from the family. It is important that they encourage you, and it's going well so far. It is very time consuming.
Yeah.
But you know that you're feeding your baby all the nutrients, what they need to grow and be strong. And I think that's more the payoff, is knowing after feeding what they just ate as opposed to what came in that can.
Yeah.
So.
And I think the icing in the cake, or the icing on the cake, is what she's going to tell you, because you're doing this for how long?
I've been doing breastfeeding for 15 months, and we don't really have any plan to stop immediately. It's more don't offer, don't deny. So I'm at the stage where if he needs to nurse for comfort, if he needs to nurse, he still does it for bed, for naps, just random things. He might just be having a long day, he just needs me, anything. And breastfeeding is more than just nutrients at this point. It's his comfort, it's his support. He knows that I'm there and I have it, and if he needs me, he can have it at any moment.
I remember we had a conversation, and you said, I asked you, what was it that made you continue breastfeeding in the beginning?
Definitely was the support, and it was taking advice in the sense of don't give formula and don't give up.
Don't give up.
That's it. That's
don't
what it
give
was.
up.
It was don't give formula, don't give up, because you just get yourself in the cycle, and it's easier to formula feed. It takes dedication and commitment to breastfeed, and not all babies latch correctly right away, and he didn't latch correctly right away, and it did take an effort, and I just stuck with it, and my fiance stuck there with me, and he supported me with everything that he could, and he did the diaper changes and the helping with the prepping food and meals for me, so that I was full of nutrients so I can give them to him. And
I think that's great, and it gives me an idea that you can perhaps tell us a little bit about latching and why it's so important.
The latch is very important in order to avoid sore nipples, for the baby to get good milk output. And what you want to do, basically, if I could go ahead and go with the model here, a lot of women are letting the baby just latch onto the tip, and that is where it's painful. You get sore nipples, get cracked nipples, and you really want to have the babies latch far deep into the breast. Okay, they're able to hold the breast where they can pull it to the back of the pellet, where the hard and the soft pellet meet. That's how far you want your breast to go into the baby's mouth.
They won't make a gag reflex?
They don't get the gag reflex, and that is when you know that you have a good latch and you're not sore at the end. So that would be a good latch.
Oh, okay.
Yeah, latching problems are probably one of the biggest nightmare of first-time moms. They just have all this pain involved with improper latching. There's something that I've seen more and more and more, and it's the tongue-tie babies. What can you comment on that?
Tongue tie, we let the doctors actually are the ones who will diagnose if your baby is tongue tied. But tongue tied is basically where the frenulum, that little piece of skin right under the tongue, sometimes it comes too close to the tip of the tongue, and your baby will cry and you'll see their tongue looks like a little heart. So in cases like that, the tongue is too short. They're not able to do the deeper latching. Okay, I've seen women who work through it and just kind of wait till it grows out a little bit and they create a good latch. And I've seen women talk to their doctors about clipping the.
So there is a solution for the problem. Yeah. That's really encouraging, because at the first office visit, most moms feel that this is a breaking point. Okay, this is where we really need to get going. So Another common question that I get in my practice is supplementation. If I choose to supplement because I'm going to go back to work or whatever reason, when is a proper time to introduce the bottle and formula? And when is it that it's not going to interfere with the lactation?
Very good question. And what we recommend is to let the babies latch on you and at times even use you as a pacifier or let them feed as often as they want, as much as they want. And this way your milk supply will increase. By the end of 3 weeks, maybe 4 weeks, you can start taking your breast milk, pumping out 1 ounce, 2 ounces, putting it in a bottle, and then training your baby to use the bottle. And this way, when you go back to work or back to school, you can actually let the baby have your breast milk in a bottle. As far as using the formula, we really believe that formula is more of a supplement, just to help in times when you won't be able to produce your milk. So it could be in cases where the baby is separated from you at the hospital and they need to be supplemented, or in cases where you've decided that, you know, you're done with breastfeeding and baby still needs milk.
Yeah, supplementing comes out so often. I feel that in most cases it's really not necessary. It's a matter of patience. You just have to wait until the milk supply forms and the baby starts growing. And it takes a few days, and then it's all, you know, history. Now, if the baby is dehydrated or losing weight, sometimes we need to offer something else, formula. Okay. So what's the best way to do that?
I will talk about a case where maybe a baby is still in the hospital and you need to supplement. What you want to do is they have a little tube, and we call it a SNS, or Supplementing Nursing System. And what you would do is take this little tube, you add the formula into the syringe, then we take it to the breast. So the baby latches onto the breast, and then the syringe is placed on the side. Then the baby is sucking on the breast, still stimulating for the production of the milk to flow, and at the same time you're still supplementing or giving that baby that formula that they need.
Okay. So you overcome the problem without interfering with lactation. Yes. That's really how important this is. Good. So I asked some of my questions. Do you have any questions that you'd like to bring forward?
Like your supply and demand. So I'm pumping about 1 ounce to 2 ounces. So I can't really do too much of on the go because I'm not pumping as much. But as my baby gets bigger, he's obviously going to want to eat more. So does your milk flow, do you produce more milk as your baby gets older? Because I'm sure he's not going to drink 2 ounces for the next 3-4 months. He's going to want to eat more.
Yes.
So does that kind of happen along with feeding, or is it just to each his own, everyone's body just creates different amounts?
Definitely demand and supply. The baby demands, your body supplies. They go through periods we call growth spurts where they just want to feed, feed, feed. We suggest mommies take baby honeymoons. This is a time when you just sleep with the baby, right? You've heard the term. You
Take a weekend vacation with your baby and stay in bed and rest and relax and nurse and nurse and nurse.
Yes, they might ask every hour, every half hour.
That was him, every half hour.
Oh my God, I thought
minutes.
a baby honeymoon was I leave the baby with grandparents and I go. That's what
Dare to dream.
So basically, you just stay with the baby.
Staying together, it's a lot of times indoors if you're not comfortable breastfeeding in public yet, but the more comfortable you become to breastfeed in public and the quicker the baby learns to feed, the easier it is. You can breastfeed everywhere, and
it's a little, I have a 2.5-year-old. So I'm trying to feed while trying to get him not to get into anything. So it is a little, I tend to get a little more discouraged with it because I feel like I'm having to sometimes cut him short off from feeding to go and grab my 2-year-old before he jumps off of something, you know, so it does, you know, but that does make sense, the honeymoon. Maybe going and just kind of.
And maybe you can have a 3-way honeymoon. bring the 2-year-old with you and watch videos and movies, and
Also, he doesn't feel left out.
So, yes.
Yeah.
And it makes it easier when, you know, they're sitting at your side, and always give them the attention. I believe give them the attention while you're breastfeeding. The newborn will get the attention just by
So the body will produce more the more that the baby starts to grow and eat.
Yes.
What about you? What you feel is your biggest obstacle at this point?
As far as breastfeeding?
Yeah.
Well, it would be the production. It would be back to work, 'cause I'm going to take about 3 months off, and that's back to work. What do I do? Do I still create milk if I use the pump, because it's kind of stimulating it, even if I'm away from the baby?
Yes, the pump will stimulate. It's not the same as the baby, so babies are our best pumps. And what the new movement is going through a lot of learning how to manually express, which does the same, more similar to what the babies do. So if you can manually express milk, and what you're doing is you're just pressing behind and pulling forward. And then you're using, once the milk is established in the first 3 to 5 days, once your milk is set, then the pump will work just as well. Okay. You can store. Initially, you'll start producing maybe half an ounce to an ounce. By the time the baby's 4 months, you'll have 4 ounces. By the time the baby's 8 months, you can get up to 6 to 8 ounces.
So as far as going back to work, how, in a day, like 8 hours, how often will I need to pump?
You, by 3 months out, your baby will probably be feeding still on a 2 to 4 hour schedule. So you would probably pump maybe 3 times at work.
Okay.
And what you would want to do is, as you get closer to the work time, pump at those times at home. So you would, instead of putting the baby to the breast, you can pump your breast, and this way your brain will start to assimilate and
develop a pattern, kind of.
Yes.
Oh, I see.
You feel more comfortable. So when you're at work, you have already in the mind set up of getting the machine on. The other thing is, make sure you have a good place at work. You need to have a place where you're comfortable, you're relaxed, you know you're not going to be bothered, okay, and it shouldn't be the bathroom.
I have a
It
locker
shouldn't be
room.
the bathroom. I like that. Yeah.
I have a locker room, which is away.
Oh, great.
So which is good, and they're pretty good about it, which I'm lucky with that.
May I add one good thing that, one tip that I used when I went back to work, because I did have trouble pumping, is I brought cues of my baby. I brought pictures, I brought, on my phone, I made videos of him cooing, talking to him, and that started the stimulation, because without it, it was like a block. I just couldn't get over the mind block that it wasn't my child there.
It's amazing how your body knows and works.
And now sometimes I'll just be walking around and hear a baby crying, and I can just, whoop, well, somebody needs to be fed. So
That's a great idea. I just took a video of him like crying or something, and then seeing and hearing it. Oh wow, that's a great tip.
This is so good. I really appreciate the questions are so interesting, and the suggestions. You said you are in the process of weaning, but it's very gradual. What question could you bring to Kika?
I guess when I am to the point where I want to wean and completely stop, what can I do? Like, do I need to, like, I've heard that I need to, like, leave the situation, like leave him with the dad for a day or two, get out of the house, leave him overnight with someone else. I don't know if I really want to leave him overnight. How can I actually wean him without physically leaving his presence? When I'm around, he knows it's available, so he's going to nurse when he needs to. And I don't know how to kind of give him the block of, I'm not nursing you anymore, we're done with that. What would I do when I'm at that point?
Well, before I go there, I want to just say the American Academy of Pediatrics is recommending 6 months of exclusive breastfeeding, and then you start to introduce solids and juices in small amounts. You continue to breastfeed, maybe on occasions, as you're doing now, okay? And the World Health Organization is recommending to breastfeed up to 2 years. So if you continue to breastfeed, because by this time you're breastfeeding in the morning, in the evenings, and like you said, just as they need, it becomes much faster, okay? So you're not gonna be doing the every 2 hours like you guys are doing in the beginning. You know, by this time,
It will
5
taper
minutes.
off, I promise.
Yes, 5 minutes, they're done, they're ready to go. So once you decide that you're ready to stop, it does take your body about 3 days or so for it to finally decide, like, oh, we're not gonna need the milk anymore. So you wanna stop feeding certain times, maybe stop the morning feed.
Okay, just
And then,
cut out a feed.
a feed each
That's a
time.
good idea. Okay.
Instead of
I don't
cutting
want to
them
do
cold turkey.
Yeah, that's mean.
Yes. Moms who have to do cold turkey for a reason or another, then your breast will get very engorged possibly, and there's fevers and other things. It would be very painful.
If you stop breastfeeding, do you need like a medication to stop it, or your body just stops?
Your body just stops. As long as there's no demand there, your body will just stop producing.
Oh, wow.
So this is why we suggest, if the baby needs to be away from you in the first days of life, bring stimulation to the breast. The machine, yes, the pumps or manual massage, so the brain knows that we do have a baby, we do need milk.
Well, another question. Once I stop, can I start again? Can I say I regret?
That's a good question.
That's great. That's a great question.
Very, very good question. And I think if you're within a window of the first year, depending on how long you were breastfeeding and how much milk your body had produced, because after you stop breastfeeding, it takes your body about a year to finally stop producing milk altogether.
Oh, okay.
Sometimes you'll jump in the shower and still notice, oh, there's still a little bit of milk.
Oh, okay. Well, that's good to know if I stop and I regret it.
And then, yeah, your body still has some leeway there.
Oh, okay.
Erica, do you have any questions?
So I don't know if these are myths or wise tales, but like what you eat, your baby can feel the effects, like spicy food or gassy food or anything like. I love spicy food, so I've caught myself eating. So actually, last night I had Thai. It was spicy, so I don't know. I ate some of it, but I kind of stopped because I wasn't sure if that was going to go on into my milk. How much of what I eat goes into my milk?
Your breast milk does take on the flavors of the different foods that you eat. And what we recommend is have a variety. Just eat everything. Sooner or later, you'll start finding out if certain foods are affecting your baby. Like if you have dairies and then your baby is colicky, it could be that your baby is getting affected by the dairy you're taking. But if you like spicy and you breastfeed 2 hours later, your milk will have the flavors of what you've eaten. So if you had the spicy and he didn't seem to mind, he's doing well. I used to do spicy, now my daughters eat spicier than I do. So it is a myth.
Too much of it goes, because I hear, I mean, I was thinking
It burned
like you could get heartburn if I had something spicy or something of that nature.
You know, and just check them 2 hours after they eat, then see how their body responds. Okay, if they get very colicky, then you can narrow it down to your foods. Like, what did I eat that might be affecting? Sometimes some babies do respond to broccoli or cauliflower or beans, but most babies do well on everything. And these babies who are breastfed have a wider palate. Like, they'll eat all types of foods. Yes.
Fruits and vegetables are his best friend.
Yeah.
He loves all kinds of food.
Yes.
Yeah.
That's the greatest prevention for picky eaters, right?
Yeah.
Well, I feel like we can go on for a long time with this tea party here, or this breastfeeding party. However, I think we covered the most important points, and I'm really happy that you came and that you shared of your time and your experience and your curiosity. So I think I'm gonna just thank you all, and maybe if there are more questions, we can have them outside the round table.
Okay. Sounds good. I just would recommend, if you do have any questions, you can go to different websites online for San Diego. There's a lot of support groups now, and we've come a long way. So please breastfeed as long as you can.
For more information on breastfeeding and to attend our free lactation classes, please check our website at pediatricsotairanch.com. You can also check cpmgsandiego.com.